I'm going to report back to you on the NHS Suffolk and North East Essex Integrated Care Board meeting. Isn't that a mouthful? Anyway, it was a meeting to discuss where we're going to go with the integration of both the NHS and social care across a massive area. Actually, it's now incorporated West Suffolk, Ipswich and East Suffolk, and it is North East Essex, and you're looking at about 1 million souls. Now, the thing that is of particular concern to me is the fact that in my locality, that's the Felixstowe Peninsula, we have now only 3 surgeries. We used to have 4. Consequence of the 4th surgery closing was that the other 3 remaining surgeries effectively exceeded their capacity for patients, because their capacity was around 30,500. With the closure of Woolton, that now, and the building that's been happening over the last year or so, that now is at a figure of 34,500 and rising, because that figure was calculated way back in June of 2020. So I returned to this board and I'd put the same question or a similar question to them at their first public meeting since COVID and their interception. And bear in mind that they actually came into effect back in April of 2020. So the question I asked was, how come the NHS isn't availing itself of money that is not a part of its budget, but is a part of a developer's contribution to ensure that the services are available for people that their new housing will introduce into our community? So have a look, see what they said.
The first time I met this committee was down in Colchester, I think in November. And I asked you then, why was it that the NHS was not supporting the expansion of the Grove to be able to meet the needs of a growing population that was actually being accelerated by the fact that we have a huge amount of development going on in Felixstowe. Potentially over 25 years, an additional 4,000 dwellings, of which it would appear probably 2,000 will be built out in the next year to a year and a half. Now, I have met with the director of Ipswich and East Suffolk Alliance, and she did give a report, and unfortunately she's had to go off to another meeting. But I've recently come into possession of documentation which was presented at a planning meeting back in June of 2020 that showed the capacity of our surgeries with the closure of Woolton surgery was 3,519. That is currently being exceeded by a population demand of 34,340, which is actually an overload of 113%. Looking at the amount of build-out that we currently have underway, that is 7 major schemes between 200 to 400 dwellings, plus another 4 coming down the track, which will be completed in the next year to a year and a half, we will probably end up with an overload on our GPs and our surgeries of about 126, 130%. I'm finding astounding that this committee or the NHS itself is not supporting a scheme that is actually supported by the councils, in that there's still payments made by the developers, 7 already, more to come, that you're not supporting the expansion of the Grove and probably Haven Health to meet the need of the existing population as well as the growing one.
And your question, sir, is?
The question is, I'm still not clear why it is that the NHS is not availing itself of money that's not a part of its budget, but would actually improve the care provided in primary care, which is desperately needed.
Okay, thank you. Ed, any immediate reflections on that?
Well, there's quite a few reflections, I guess. But so Maddie's gone to Felixstowe, as we just know. We're launching a review of demand and capacity in Felixstowe and the surrounding areas from today, which will be a piece of work that I think is due to conclude at the end of June to report, which will cover all of the issues you've described around housing growth and capacity in the local health service. So I think we'll have a much clearer view at the end of that. But the challenge in Felixstowe, as Peter said, is the kind of challenge all across SNE. We've got huge growth in, Peter mentioned Haverhill and Bury. We could talk about Colchester being the fastest growing community in the country. You know, we've got a big challenge around our resources to meet the growing demand. So there's a specific piece of work on Felixstowe, and we will absolutely involve you in that, Mr. Nimney. But the challenge, I guess, for the board is how we're going to respond to this in many communities across SNE.
Yeah.
I agree with your answers to a degree, but what I find worrying is the community infrastructure levy, which is specifically put upon the developer to ensure that the services are going to be there for the residents they're bringing to a community. They aren't going to actually make the services to the existing community worse than it would be. We're not using the money that is already available to us to use. So I find that very disturbing.
So I agree. We shouldn't miss that opportunity, and I don't know what the blocker is to that. I'll find out.
We'll find out and report to a future board. Okay, thank you very much. Any other business?
Well, that was an interesting response, wasn't it? At least we've got a definitive two officers, one of the Integrated Care Board and one of the Suffolk Alliance, who will be engaged in looking at it, I think, across the whole of their area. That's Suffolk and Essex. And hopefully we will end up with a sensible solution, because we do need, if we're going to be looking after myself and my family and my friends, equally the new people that will be coming in to live in the new housing, then we do need an adequate provision of consulting rooms, equally and probably more importantly. You're aware that though there was an attempt by the NHS to recruit significantly more doctors, GPs particularly, the reality, I think, is there's a further shortfall of about 800 or so. And what we also know is recruiting them into our particular area, coastal areas, is very difficult. So if you're going to recruit them into an overloaded system with poor consulting facilities and the rest, one would assume they'll probably not come. And we do really need them to come for the benefit of us all. Right. It was quite a big agenda at Bury St Edmunds, in the St Edmund room in the cathedral. A whole stack of stuff. I suppose there were a number of key areas, but the one I would like to concentrate on is is that one, our integrated care summary. Yeah, and that's really laying out, as far as I heard or could hear, what it is that this joining together of the NHS itself, the National Health Service, with care provision and help, and also local authorities, charities. But let me just, what was a very helpful sheet there that was given on the day was that one. I'll get Bernard to include this at the end of this little chat. And it says that our integrated care strategy in 6 numbers. 1 million people. That's the geographical area is at least that, because if we look at all the building going on, that's an underestimate, isn't it? That figure will be undoubtedly a much larger by the end of this year than it was at the beginning. And it says, we are one team with a shared vision of the best possible health outcomes being a reality for one of the 1 million people that we all serve. So, well, that's me, that's you, that's everybody. They say 2 counties, because you've got Essex and Suffolk, which is the way it is. We work flexibly with wider partners across the 2 counties of Suffolk and Essex. Now, what they've decided to do is they're going to have 3 local alliances, so you've got the Integrated Care Board, and then beneath that you've got 3 strands, and they are effectively West Suffolk, Ipswich and East Suffolk, and then North East Essex. So you've got, you know, a triumvirate nearly of service providers, and they are going to coordinate the delivery as locally as possible through those alliances. And then they've got, it would appear, 4 collective ambitions, and these are the best health and well-being, a genuine reality for all, the opportunity of health equality for everyone, everyone able to live well, start well, be well, stay well, feel well, age well, and die well. There, that goes, quite a lot of wells there. A genuine can-do health and care system that people can trust. They go on to say 5 equal sector partners. We believe in parity between all 5 sectors in the ICS, that is NHS, primary care, social care, public health, and the voluntary community, social enterprise and faith sector. I would suggest things like budgets and paying for and will probably ensure those who've got the biggest expenditure or the biggest demand or is failing the less. It would be quite nice to think that they were equal, but in reality, delivering our health, I don't think that is particularly realistic. Now, 6 can-do values, and it says the way we work together as a can-do health. I've heard of can-do before, haven't you? Can-do. And care system is underpinned by our 6 core values. That is collaborative, creative, courageous, compassionate, cost-effective, and community focused. Now, one thing that I can say, and I've been I've seen 4 or 5 different complete reorganisations happen, and it seems when governments get into problems, they say, I know what we'll do a reorganisation and that will fix it. Anyway, we're in the midst of one now, and one thing that always came out, be it NHS Suffolk Coastal or NHS Suffolk or CCG, that bit there, cost effective, was actually the first item on the agenda. It's quite nice to see that this time it's actually the 5th on the agenda. So perhaps we should be thinking rather more, what is it that we need to be doing to ensure that you and I and our neighbours get a decent health service and a decent care service living here on the Felixstowe Peninsula and wider afield. So that's just a quick update, and the integrated care strategy will be something that will be discussed, I'm sure, in every little club, every pub, every restaurant and on the seafront. Anyway, you have a good week. See you the next time.